Hello everyone, welcome to Kinesiology 2030 in today's lecture, which is from Chapter 3 of the textbook, Promoting Mental Health. So what essentially we're going to talk about today is look at the difference between mental health as well as mental illness and just make sure that we have an idea of what some mental health and mental illness conditions are. So as health professionals and health educators, we could potentially point people in the right direction to where they should seek help if we see any potential signs for mental health or mental illness. The other thing we could do as health professionals and health educators is provide some people with some mindfulness tips in order to help improve mental health, as well as keep people on the right track to avoid mental illness. Now, there's one thing I want to talk about before we get into the lecture, and that's scope of practice. As health professionals, health educators, we do have the ability to help people develop tools that will reduce stress in life that may lead to better mental health and decrease risk of mental illness. But we are in no way certified to diagnose someone or tell someone that they do have mental health problems or mental illness problems. So, what we need to do as health educators and health professionals is understand what mental health is and what mental illness is. So, we can better our clients by, as I suggested, pointing them into the right direction if we feel they might be needing some more specialized help. So, if you want to deal directly with mental health and mental illness and be someone who can diagnose as well as provide more concrete development plans for someone who's struggling with mental health and mental illness, then you would want to go into that as your potential profession. So psychology and kinesiology side, it could be sports psychology, could be behavioral psychology. There's lots of different professions that could lead you to help people with their mental health. Mental health is obviously a very important part of health. We've seen it in my pyramid with the mindfulness. We've seen it in the wellness wheel with emotional health. So we do know that it does play a key role in our daily life, and it also helps with feeling good about ourselves and preventing other physiological problems as well, not just the mental health side of things. So, what we're really going to focus on today is really the steps you need to know in order to be able to spot signs of mental health and mental illness, because you want to make sure if you're working with someone and you see that they might feel a little bit depressed or they might feel a little bit down, you want to have the skills and the abilities to notice that and potentially suggest that they see someone in the profession to help them a little further. But definitely as health educators, health professionals, or even personal trainers, strength and conditioning coaches, kinesiologists, you definitely can help people with prevention of mental health or mental illness by providing them with useful tasks within your scope that will help, just make sure that they have good mental health. And that's providing them with the understanding of things like meditation or mindfulness or journaling or gratefulness journaling, and really giving them a bit of an idea of what they can do to help with the prevention. So the focus today, though, is going to be on recognition to help with prevention. So the first thing I want to talk about is the difference between mental health and mental illness, because there is a difference. So if we look at the World Health Organization's definition of mental health, it is a state of well-being in which every individual realizes his or her own potential. So it's something where we can cope with normal stresses of life, we can work productively and fruitfully, and we also can make contributions to his or her community. So as you can see with this definition, there's really 4 points to note. So first and foremost, it's about ourselves and it's about our well-being and making sure that we are essentially taking our care of ourselves with self-care methods that are going to allow us to make sure we have time for us and make sure that we have time for our mental health. Then you see the next thing it mentions about stress, which is an important part of mental health because every single one of us feels stress in our life at some point, probably daily. There's stress that we feel. It may not be extreme, but there may be some little bit of stress each and every day. And in order to have good mental health, we have to be able to cope with that stress. We have to be able to deal with that stress. We have to be able to identify it, understand it, and figure out how to make sure that it doesn't affect us negatively. And then it involves our work productively and fruitfully. So essentially, it's just as a student or as an employee or an employer, you need to understand how mental health will affect your productivity. Because if you have declining mental health, that's going to affect things like sleep. It's going to affect things like motivation, and it's going to potentially hurt what you are doing within your education or your profession. And then it involves community as well, because that's an important part of mental health is having a community, having a tribe around you, making sure that you contribute to that community or tribe in order to improve on it through your actions. And that's going to help your mental health. Now, if we look at mental illness, the Canadian Mental Health Association identifies the following as what mental illness is. So anxiety disorders, depression, bipolar disorders, eating disorders, obsessive compulsive disorders, phobias, panic disorders, post-traumatic stress disorder, schizophrenia, suicide. So these are all mental health illnesses or mental illnesses. So if you look what the main difference between the two is mental health is really a mindset, and how your mind is coping with the daily stress and the daily aspects of life, where mental illness is a diagnosed disorder. So that's really where we look at the main two is our mindset versus a actual diagnosis. Now, if we continue looking at some aspects that the Canadian Mental Health Association talk about with mental illness, one thing we need to realize with mental illness is mental illness, it can vary greatly. It could have different intensities, it could have different severities, and it all depends on the individual. It all depends on the individual's stress that led to the mental illness. So some people could have very minor diagnosed mental illnesses, while others can have debilitating diagnosis of mental illness. The key, though, to note is mental health and mental illness, there's not really a continuum. So it's not, it varies so much from person to person, from illness to illness, or from mindset to mindset, that it's hard to really, it's not black and white. It's very gray. And people with mental illness, it does take them a long time to figure out what works best for them in order to handle the mental illness while dealing with everyday life. And whether it's medications that they use or behavioral modification therapy that they use, there's lots of different avenues to take with mental health and mental illness when we explore how to help people with it. And one thing also we should understand is good mental health, it can exist in individuals with mental illness. So mental illness as I said, it's a diagnosis, and it could be a genetic disorder, or it could be a compounded result of too much stress or other mental health related uh, issues. Uh, but someone with mental illness, it doesn't mean that they have to have poor health and poor mental health. It's one of the aspects that we look at when it comes to intervention is we do a lot of mindfulness in order to help us with our mental health, but also we do a lot of this same mindfulness work when we have different mental illnesses. Now, there's some research that indicates that people who have high levels of mental health are associated with lower level risks of mental illness. So, there is some research that's showing that mental health can have a direct impact on your mental illness and your diagnosis. So definitely, we do see some mental illnesses that are a genetic aspect, but we do see some that are developed over time. And good mental health will essentially lower the level of mental illness or the risk completely of mental illness. So it's important that we practice mental health, and it's important that we practice it regularly. It's also important that we start it at a young age. Mindfulness is such an important part to teach kids so they can start developing the tools necessary in order to develop good mental health and coping skills throughout their life. So looking at like elementary schools and everything where we're teaching young children, introducing simple mindfulness techniques like meditation or breathing exercises or relaxation mindfulness exercises. It's a good way to help them understand how to cope with the stress that they feel. Because a lot of the times we don't think kids feel stress, but absolutely they do. And if we start putting a lot of stress on kids at an early age and not give them the tools they need in order to succeed with their mental health, it can lead to mental illness later on, or it can lead to other potential physiological conditions later on. A great example, we look at mental health and kids, is sports specialization. If we want to sort of rein it into a kinesiology example. Right now, we're starting to see a tremendous amount of pressure on kids at a very young age to specialize in one sport. And the parents push them into the sport and they put them in all to the different training activities. They're in their regular sport, then they're in skill work, and then they're in personal training sessions, and they're putting all this pressure on them. And that, it might just seem like, oh, you're just playing a sport, but in reality, that's compounding stress on a child at a young age for a long period of time. And a lot of times, those kid athletes, as they get older, they develop a lot of mental health issues that could lead to mental illness, some just lead to other problems like burnout, where they just quit the sport or quit activity altogether because they just have a real negative mindset because of the pressure that's been put on them. But the biggest risk of doing that is the potential mental illness diagnosis that could come with it. So mental health needs to be started at a very young age, and having an understanding of that is going to help everyone with their overall health, not just their mental health, but their overall health. So one of the important things to do and understand as a health educator or a health professional is first off knowing the risks of what poor mental health can lead to. So usually, if we look at what mental health is, the first thing that we kind of associate mental health with is stress. And that's where it really begins, is being able to manage our stress. If we can manage our stress, then that is going to be a tremendous advantage mentally as we go through our life. All right, because as I said, stress is going to happen. Daily stress is going to happen. And how we manage it is going to be really the determining factor of our mental health and whether our mental health starts declining or whether we rise above and have a good, strong mindset. So, one thing we should try to do is start each day by recognizing it is an opportunity to do good, to be good, and to feel good. That's why I really like journaling and doing a grateful journal. And in our first lab, which is the behavioral journal, we will have a grateful statement. Each day you make a grateful statement, what you're grateful for on this very day. Because research actually shows that if every single day you write out what you're grateful for, it's a powerful tool of recognition of something positive. So right away, by putting something you're grateful for in out on writing, it it puts positive, it puts you in a positive mindset. All right. So just by doing that and recognizing the opportunity you have every day to do something good, to be good at something, and to feel good about something, that allows your mindset to be positive. Now, another thing that we want to look at with stress and mental health is what we should really be going into our mindset. And you're going to hear me say mindset a lot because I believe that's what really decides things, right? If we look at behavioral change, which we've talked about, your mindset is going to lead to successful behavioral change. And it's the same thing with mental health. So when we have daily stress put upon us, there's two things we can do. All right, we can let it bother us to the point where we start breaking down, or we can use it as an opportunity to grow. All right, and it's the old fixed mindset versus growth mindset. A fixed growth set is someone whose mindset is very fixed on, being successful and not being successful. And if they're not successful, the fixed mindset tends to let that really stress them out and bother them. Where growth mindset takes every single stress or every type of failure or success that you've had and work on learning from it and how to get better from it. So that's one thing we should try to do when it comes to the stress, is use this opportunity to grow. Another thing we want to do is make sure we feel worthwhile and that we have a purpose. Because if we're just sort of going through life without a purpose or not feeling worthwhile, it's gonna have a negative impact on our mind frame, and it's gonna have a negative impact on our mental health. Because all of that not feeling worthwhile, not feeling a purpose, it builds up. It builds up and it almost puts like a weight on your shoulders. So if you feel like you're worthwhile, you feel like you have a purpose, you'll feel good. Again, your mindset will be nice. It will be good. Right? Also feeling that what you do makes a difference. This is a big one that I live by with my life, is every single day I try to do something that's going to make a difference. Whether it's something little, like putting a smile on my kid's face, or helping someone with something simple, or sharing something on social media that I think people will get some use out of. I like to feel like what I'm doing is making a difference. And so I try to do something every single day. And for my mental health, I find that really helps. it makes me feel like I have a purpose. It makes me feel like what I'm doing is worthwhile, and it makes me feel like I'm taking opportunities and growing. So that's a little thing that I do when it comes to trying to, you know, avoid some of the health risks of poor mental health by trying to make a difference. Another thing too, you need to feel content with who you are and how we live. And I mean, I think this one here is one that a lot of outside people impact on other people's mental health. And it's things like how people judge you on something that you do, or maybe something like the social media cyberbullying, right? So things that you do or how you live, the best thing to do is if it makes you happy, makes you content, then you should keep doing it. And you shouldn't let the haters affect that. Because the moment you let them affect it, then what's happening is it's changing your mindset. And it's changing and it's making you question whether what you're doing is worthwhile or it has a purpose. Right? You need to make sure that you're content with it, that you're happy with the way you live, and not worry about what other people are doing or what other people are thinking so much, right? Because if we constantly are trying to compare ourselves to others, then that is going to bring unnecessary stress upon us. So sort of letting go of that competitive or comparison nature and just doing what makes you feel good and content with your life is an important aspect of mental health. Now, as health professionals, health educators, kinesiologists, whatever it is you end up being, we need to understand what the signs of failing mental health are. So, why we need to understand that is so we can see if people are potentially struggling with mental health. So we can guide them to take the right steps necessary to seek help. And as I said, big thing, scope of practice. You want to make sure you lead the people to the experts in the field. Especially the moment you think someone's got a mental health or potential mental illness. You want to lead them to the right person immediately. So understanding what the signs are important. And I have a few here, but there is probably a lot more. And as health professionals, it's your job to understand what they are and understand how to see signs in people. And a lot of that is, the words here on this PowerPoint give you an idea, but it doesn't quite measure up to what experience does and what actually seeing someone who's battling with mental health is like. And the moment you see it and understand it, you'll have a better idea of what it looks like and how to help somebody. So some basic signs and symptoms of declining mental health are things like listlessness, an overwhelming sadness. Now, you have to know the difference between the overwhelming sadness because a lot of us get sad throughout our life. And the difference between having good mental health and poor mental health is coping with the sadness and, again, using it as a growth. So overwhelming sadness is going to be someone who is so overcome with their sadness that they can't function through their daily life. Like they struggle to really go about their day. So overwhelming sadness is just, it's one that again, as soon as you experience it, you understand it. Whether you go through it yourself or you see someone go through it, it's it's one that is a very glaring sign of concern and when you would need to help with some intervention. Another sign that we see is an inability to enjoy life and the people, places, and things um, that were previously brought us pleasure. So if you feel this yourself or you see someone going through this where there's certain people that they enjoy being around and all of a sudden it just doesn't seem to bring them happiness, then something is happening with their mental health. And then that usually leads to the next one, which is withdrawing yourself from social activities. Right? So you stop, you lose the pleasure of social aspects or going to certain places that you just don't want to anymore. And you withdraw yourself from that. Also, we see people who have failing mental health or declining mental health when they feel distrust or leery of others for really no apparent reason. Again, if it's easy to see, it's easy to tell when you actually see it. But if you see someone who's usually a trustworthy person who all of a sudden is just not trusting something that someone's saying, and it really doesn't make sense, then there could be a greater issue. Another thing, excessive worrying, right? Especially when it's not, the worry might seem misplaced or exaggerated. That's a definite sign. We also see any sort of obsessive or compulsive thoughts that do not go away as being a glaring sign for mental health. And then also the most concerning one, which is frequent thoughts of ending our life. And when those are consistent and they don't seem to go away, they eventually lead to potential suicide tendencies. And so we want to make sure that we intervene and get that person to seek the help they need. So just understanding these basic signs and what they look like. And as I said, the best thing to do to really understand is work with people and experience them. And then you want to make sure that these signs are regularly consistent. You don't want to see someone who's overwhelmingly sad, who usually isn't, and you see them like that one day, and then you say, okay, well, we need to intervene. We need to get this person some help. If it's just like 1 or 2 days, maybe something really bad happened. So that's why it's always the first thing you want to do is when you see a sign, start asking questions. Start asking questions about, if you see someone with overwhelming sadness. Okay, well, I see that you're sad. Like, what's going on? Right? Just start asking questions. And if they give you a glaring, obvious answer of why this is, then, so if it's a friend and they're really upset and, you don't know why, and then you talk to them, you find out that they just broke up with their, with their partner, and they're just distraught by it, right? Well, that's a regular reaction to something that's very sad for someone, right? When you get concerned is if you see this behavior multiplying and continuing throughout several days, and they just don't seem to get better. That's then when we look, okay, now we're starting to see this mental health. I think, though, the one exception is if you know or hear anyone mention that they want to end their life, I think intervention needs to be almost immediate at that point. Because that's a serious thing to be thinking about. and you want to take action on that in case it is something that the person is literally considering doing. So that's, I would say, would be the one exception, um, versus the other ones, where if someone's thinking about ending their life, get involved right away and get them to seek help that they need. Now, when it comes to life stressors, there's lots of them, as we all probably know. You, as students, know all the stressors: exams, working while doing your studies, friendships, social media now. There's lots of stressors out there. So understanding the inverted U hypothesis uh, helps, because what the inverted U hypothesis suggests is that there's an optimal level of stress that is needed to reach our peak mental or physical performance. So there's one thing about stress is stress, like, as much as we hear that word and we instantly think negative, there are some positive aspects of stress. If we think of physiology, when we stress our body, it will adapt and get better. And that's what training is. That's what strength and conditioning is. That's what exercise physiology is. Understanding that a stress stimulus placed upon the body will adapt. And that's like any stress. The body is, its goal is to adapt to the stress that's placed upon it. And the body will adapt to it. The problem becomes when it becomes a chronic stress, where it's something that happens over a long period of time. We don't take the right actions to cope with the stress, and then it develops into potential physiology problems and psychology problems. So a couple of the life stresses to think about are the eustress and the distress. So eustress is stress we experience from situations we choose to participate in. So some examples of those are things like going on a first date, competing in a sport, training our body, right? Those are stresses that we are choosing to place upon our body. Where distress is stress that is not within our control or that we would prefer to avoid. So something like a car accident, experiencing an injury, experiencing a breakup, right? Those are distresses. Now, our body is designed to handle both types of stresses. Our body is designed to try and get better from it. So a eustress, if we look at that right off the bat, physiological training, for example, the stress that we choose to put on our body, that makes us better. Okay? Distress, if we get an injury, guess what our body does? It immediately starts healing it. Right? The problem is when these stresses, regardless of whether it's stress that we choose to participate in or that we don't, if they're chronic, if they're constant, they will lead to further problems down the line, down the road. So what we need to do is understand these stresses and then also understand how we can use them to our advantage versus how we can versus letting them cause greater problems. So a couple other definitions to think about too are stress, stressor, and stress response. So this is important wording because you'll see these words throughout your kinesiology degree, whether you're in strength and conditioning or exercise physiology or motor learning or biomechanics, you'll see stress, stressor, and stress response, because it's an important part of kinesiology, because putting stress on the body is how it gets better. So what you need to understand is what the stress is and what the appropriate amount of stress is. So if we look at the definitions for stress, the definition of stress refers to a person, place, or thing, real or imagined, and it's physical or mental, and we react to it physically or mentally. All right, so physical stress is obviously things like lifting weights to get bigger or stronger or more powerful. Mental stress are things like exams. You have an exam coming up, you're anxious, you're stressed about it. That is more of a mental stress. Physical stress can obviously lead to improving your body, while indirectly improving your mind. And mental stress can directly affect your body. Mental stress could lead to the body breaking down. High stress situations over a chronic period could lead to heart disease because it increases inflammation. That directly affects your body. So you need to note that as well with stress. A stressor refers to person, place, or thing we react to. And this could be physical, mental, environmental, or philosophical. So what we look at as stressor in kinesiology, the main stressor you're going to be looking at is the stressors that go in the body, to the body. The amount of weight you lift, the distance you run, right? Those would be stressors. In the psychology of kinesiology, so sports psychology, you would look at the mental stressors that are placed upon you, the competitive side of things, the competing in front of people, right? So the more the psychological aspect of it. And then the stress responses is both our physiological and psychological reaction to the stress. So how does our mind and body react to the stress that we're placing upon it? Now, there's a very important thing to think about and look at. And if you go into my strength and conditioning course, or you go into someone else's exercise physiology course, chances are you're going to see this. It's called the general adaptation syndrome. And what the general adaptation syndrome is really describing the fight, flight, and freeze. So when we perceive a stressor, our hypothalamus, pituitary, adrenal system gets to work. And so what happens is there's a reaction. And the reaction is going to depend on the severity of the stressor, as well as our individual perception of the stressor. So the fight or flight, you probably have heard about the fight or flight, part of the nervous system that essentially that's activated when we are stressed. And the general adaptation syndrome essentially gives us an idea of what our body does during that fight or flight or freeze. So if we look at the first phase, which is called the alarm phase, and this is the initial preparing for fight or flight. So this is when we first see or feel the stressor. And what happens is the stressor comes and we have our initial reaction to it. And generally the initial reaction is we actually go below our homeostatic line. And what happens is our body starts preparing. All right, so we actually start seeing blood being shifted through the body, and essentially hormones start getting released. Adrenaline is typically the hormone that gets released in this state. it leads us to the second phase, which is resistance phase. Now, the resistance phase is trying to return the body to normal. And this is where we see the severity of stress and the reaction to it, that factor. So chances are, if you're walking through the forest and you run into a 8-foot grizzly bear, that is going to signal your fight or flight. And what essentially happens is you get that initial, oh my God, there is a grizzly bear in front of me. And that's kind of like the freeze. It's just the initial, your mind trying to process what is going on. And then your body will release the hormones. In this case, you'd probably get a flushing amount of adrenaline going through. It will try to get you to normal, but it will actually rise you above normal. And this is when we start seeing and hearing of the superhuman strengths that people go through. You've probably heard of the parents lifting cars off their kids. These superhuman strength feats. And it's happening because of this phase. It's happening because you're in this resistance phase and the fight is taking off, or the flight, depending on your personality. And you can do things that you wouldn't be able to do at a homeostatic level. So if you run into that bear and you start running away, you're probably going to run faster than you've ever run before, because your body is essentially giving you the hormones and the ability to do something that you don't usually do. But then we lead into the exhaustion phase. Now, the exhaustion phase is when all the adrenaline and all the hormones are gone and the body goes back down to normal, but in most cases it goes below normal. So it takes us to what's called the rest and digest aspect of the nervous system and the response. So this could lead to wear and tear on the body. Now, the general adaptation syndrome is used for all aspects of stress, whether it is physiological stress, psychological stress, whatever it is. We use the general adaptation syndrome to explain what's happening to the body, what's happening to us when we go through stressful situations. Now, if you take my strength and conditioning course, we will look at general adaptation syndrome and how we can use this to make us stronger, make us more powerful. And I'm not going to get into that because that is explained more in that course versus this course. But for this course, just understand this is what's happening when we are stressed. So our body will go through various stresses throughout our lifetime. And we have acute or chronic stress. Now, acute or chronic stress will lead to the same physiological, psychological events that take place. So whether it's acute or chronic, we are going to see our immune system impacted. We are going to see our cardiovascular system impacted. Okay, you can imagine what the cardiovascular system would do when you run into that big grizzly bear. Your heart rate's going to jack up, right? We're going to get inflammation responses. We're going to see inflammation increased in the body when stress happens. We're going to see an increase in blood pressure, all right? Because all of a sudden we have this, our heart rate's going up, we have more stress happening on us, and our blood pressure is going to have to go up too. So these are really the 4 basic responses that go on physiologically when we go through acute or chronic stress. Now, the problem is our body can handle acute stress. So acute essentially means not very often. Our body can handle it. So when we have multiple acute stress placed upon us and enough rest in between those stresses, our body will adapt to the stress, right? So if you run into that grizzly bear once a week, eventually your response is going to drop because your body has done this and gone through this multiple times. It knows what to do. So it won't have to go through the whole response. It'll be cut and short. And essentially it'll be like walking, oh, there's a grizzly bear, I'm going to get out of here. And it just happens quicker because you know it. You've adapted to it. And our body will adapt to acute stress and actually make our body and our mind stronger. The issue with stress is when it becomes chronic. And so chronic stress is when we constantly have the same stress put upon us for several days or weeks or months or years. It's one reason why we see people who seem healthy have cardiovascular disease and heart attacks, because they might eat well and they might exercise, but if they're not handling their stress, guess what's happening? They have constant cardiovascular increases, constant blood pressure increases. They have inflammation happening. Cardiovascular disease essentially is just inflammation of the blood vessels. Research is starting to come out and show that inflammation is what causes plaque buildup, not saturated fat or fat, but inflammation. And we'll talk more about inflammation with nutrition when we get into nutrition, but inflammation because of chronic stress happens as well. And then it impacts our immune system. It's one reason why people who have high stress jobs or who are dealing with chronic stress are at greater risk for cancer, because their immune system is compromised because of the stress, because they're going through that general adaptation syndrome constantly. So they're flushing their body with all these hormones and the tear down process, that their immune system is impacted because it has to work in order to recover that. And if we don't allow our immune system to prioritize what needs to happen, it gets compromised. It's one reason why type 2 diabetes is on the rise. All right, because we have high sugar diets and we have high stress lives. So our immune system is trying to compensate for the high stress lives as well as too much sugar, and essentially the insulin just gets so out of whack that we give ourselves diabetes. So acute stress is fine if we know how to manage it and it doesn't become chronic. But when that acute stress becomes chronic, that's when it becomes concerning, because it's going to lead to declining mental health, but it's also going to lead to physiological problems. And again, why as health professionals, health educators, we need to understand the signs of chronic stress so we can help people seek what they need. Now, there's lots of stressors that are within our control. And that's another thing that we need to know is, and why I stress mindset so much, is because our mindset towards things is what's going to control the stressors. And controlling the stressors is such an important part of stress management. If we can decline the amount of stress in our life just by managing it, we are going to be healthier people, both physically and mentally. So we need to understand that. And some examples that we have within our control are nutrition. Whether we eat right or we don't eat right, that's completely under our control. And guess what? Poor nutrition is stress. It's stress on the body. Too much sugar leads to inflammation in the blood vessels, because as soon as the sugar enters the blood vessels, it's unpredictable. And what it does is it bounces all off the blood vessel walls, and it causes inflammation. Too much exercise, too little exercise, again, under our control. All right? It's hard to believe, but too little exercise is a stress on the body. Too much exercise is stress on the body. You have to know how much exercise is ideal. And you'll learn that in our 1120. You'll learn that in advanced principles in resistance training and strength and conditioning 3303. We'll talk a little bit about it when we get into physical activity. But understanding that too much exercise leads to stress, too little leads to stress. Too little sleep. Okay, not getting enough sleep. We've already talked about that. That's a stress. And that's going to lead to psychological and physical problems. Too much alcohol consumption. Again, too much alcohol consumption is a stress on our body. Time management. Time management is probably one of the most important parts of stress management. If we can manage our time, if we can manage our time to make sure that we eat properly, we get enough exercise, we get our sleep, it's going to be huge on our mental health as well as our physical health. So what we need to do when it comes to stresses within our control is effectively recognize our stresses by control, commitment, challenge, choices, connected, and courage. So again, it's your mindset. It's all within your control, and you have to change your mindset. You have to have a mindset where you believe you can control those. I had a message from a student the other day who he's not the student isn't in any of our isn't it in our classes. It's a student that I had a few semesters ago, and the student emailed me and just said, I'm having a really hard time with the amount of work I have to do for school and finding time to exercise. And I said to him, so you're too busy. And he said, emailed back and said, yes, I'm too busy. And I just messaged him back and said, that's your mindset. You have set your mindset to be too busy. There are literally movement vitamins everywhere. You just need to control the time of when you can get those movement vitamins in. And like I said, it's a mindset. I understand that people are busy. I understand that people are trying to work and do courses and live. But control your time. And you do it through commitment. And you have to understand that it's going to be a challenge. But you can choose what you connect with and what you don't. And if you give yourself the courage, you will be able to succeed in controlling the stress. And that is such an important part. And it really starts with time management and understanding your time. Everyone should be able to really control their time quite simply. You know you should have 7-8 hours of sleep a night. And then the rest of the time you have for work, school, movement, eating, fun. How you control all of that will determine whether you're successful with it. And that all starts with your mindset. Now, there are stressors that are out of our control. There's definitely stressors that are out of our control. So some examples, things like weather, all right, temperature, humidity, that's out of our control. Air quality, BC, our air quality goes down some summers because of the smoke from forest fires. It's out of our control, but guess what? That's a stress. That can stress our That can stress our respiratory system, our cardiovascular system, right? Noise pollution. Noise pollution is out of our control. We need to be able to know how to deal with it, and especially if it's something that's happening at night and affecting our sleep, which is going to affect our mental health as well as our physical health. Getting into a car accident, another one that's hard to control. No one wants to get into a car accident, they just happen. Getting an injury. Some injuries are unavoidable. All right, if you're an athlete, you know a contact injury is sometimes an unavoidable thing. And things like age, sex, ethnicity, out of our control, obviously. So, what we need to do is manage our response to stress, whether it's control or out of our control. So, our overall goal of stress management should be to learn to take control of ourselves and respond to various stressors appropriately. Again, what's that? Mindset. What is your mindset in managing stress? The first step you need to do is learn to recognize our physical and mental reactions to stress. And whether that is a trigger that you have that leads to a poor reaction to stress, or it is a barrier that leads to behavior or a habit. When you've come across stress, the first thing you need to do is recognize it. The second step is developing techniques to manage the stress. What are your techniques to help yourself manage the stress? And this is extremely important. And it's going to lead to our first discussion question on the discussion board. And that is, what are some strategies that you use to manage your stress? Because I'm sure all of us have it. Some of us just need to understand it and write it out. Right? So the discussion that you're going to go onto the mental health discussion board, and I'll start the discussion by putting one of my techniques. And what I want you to write out is, what is one of your techniques to manage stress? What do you do? All right? Just 2-3 sentences letting everyone know what you do. Because you know what? By doing this, you're going to help others. You're going to help others because there may be techniques that you use that they've never even thought of and that might be completely helpful for them. So we're going to put that on the discussion board. What are some techniques you use? That's the second step. And then the third step, or the longer term step, is, do you do the things that build up resistance to stress? And are you refraining from the situations that give you stress? And I think, and I know I say it and it just sounds so simple. And I understand the reality is it's difficult. But we need to build our resistance to stress, and we need to reframe the situations. I've had people that I've worked with that I've noticed have had declining mental health. And it affected everything. It affected their training. It affected their relationships. It affected everything. And I talked to them about it, and I advised them to go see somebody. And they went through these steps, and they learned that the mental reaction they were having to their job was causing them stress. So they tried to develop techniques to manage the stress, but it wasn't helping. It helped a little bit, but it wasn't helping because the same stress was happening. And the end result was they left that job. It was the hardest decision they had to make, but they made it based on their health and their overall longevity and quality of life. And those are sometimes the hard solutions that you have to come up with. It could be a relationship, it could be a job, it could be the program you're taking in college, it could be a number of things. But if there's one thing that is causing you that much stress, you need to ask yourself, do I need to put myself in this situation daily? Because it's just going to reduce my health over and over and over. So sometimes mental health means doing things that are difficult and out of your comfort zone. But that's how we get better. That's how we get stronger. That's how our health improves. Now, stress, one of the most common mental illnesses that are developed through stress is depression. So understanding depression for health educators is important. It's estimated that between 8 and 12% of the population suffer from some type of depression. Again, it's very different. It's very different severities, but 8 to 12% of the population, it's estimated, suffer from depression. 1/3 of all cases of depression are preceded with general anxiety disorder. And the research is indicating that women seem to be at greater risk than men. So depression is a big one. Depression is one that can lead to a lot of problems, including thoughts of suicide and death. And most people who do commit suicide, it's due to depression. Compounding stress that has led to depression. So understanding what depression is and what it looks like is important for health educators. So if we see someone who's feeling sad or having a depressed mood, they could be depressed. Again, asking questions is important. Have they been feeling sad and in a depressed mood for a long period of time? Or did their dog just die and they're sad about that at that point, right? And sadness could lead to depression, or it could lead to growth. And obviously your mindset's big on that. But depression, it's hard to define. It's hard to see because it's different with everybody too. There's loss of interest or pleasure in activities that you once enjoyed. We see appetite change. It could be weight loss or weight gain. And it could be unrelated to dieting. Trouble sleeping. Some people have a hard time getting to sleep when they're depressed. Some people sleep too much when they're depressed. They just can't get out of bed. They just keep sleeping and sleeping. Loss of energy, increased fatigue. They don't seem to be interested in physical activity, or there's an increase in purposeless activity. They get feelings of worthlessness or guilt. Also, we see concentration problems, have a hard time thinking, making decisions. And then, of course, the big one, thoughts of death or suicide. So when you see these types of symptoms coming into someone, into their daily life, ask some questions and decide if you need to intervene and get them the help they need. Now, another thing that we see a lot, especially here in Canada, is seasonal affective disorder. You've probably heard of this. And this is reoccurring depression that begins in the fall and continues through the winter and then goes into remission in the spring. So it's essentially almost like depression during during fall and winter. It's categorized by having low levels of energy, very moody, seem to have very little zest for life, feeling depressed most of the day or nearly every day, having problems sleeping, experiences change in appetite or weight, having difficulty concentrating, feeling hopelessness, worthy, or guilty. So you can see that it's very similar to depression, but the difference is it's happening during a specific season. And in Canada, it's the fall winter because it's dark early. All right, so it starts, in November we start seeing the sun going away at 5:30, and then into the winter it gets dark at 5. And so it's dark. Now we see an estimation between 1.5 and 9% of the population. And again, it depends on the latitude. Go up further north, where they have, darkness for 24 hours, it's going to be at a higher percentage. But it always is because of sunlight. And when we have a reduced amount of sunlight, it's going to influence our circadian rhythm, our serotonin, and our melatonin levels. And it's going to affect our sleep. Three-quarters of the cases actually occur in women. And what we're starting to see now, that a simple thing to help with SAD, seasonal affective disorder, is vitamin D supplementation. Because one of the reasons we suffer from SAD is because we're not getting enough vitamin D. And vitamin D is an important vitamin and hormone in regulation of our body. It helps with sleep. It helps with energy. It has a lot of important functions. And so when we're not getting enough vitamin D, it could lead to the seasonal affective disorder. So there's research that's starting to indicate that supplementing vitamin D during the fall-winter season is actually helping SAD. Now, some other things to think about when it comes to mental health are things like generalized and social anxiety disorders. So generalized anxiety disorders, they're persistent and always involve excessive worry. Some people have excessive worry about their health. Some it's family, money, work, school, or other issues. But it's just there's something that's causing this anxiety. That's generalized anxiety disorder. We have social anxiety disorders as well. And that's the fear of being judged, negatively evaluated, or rejected in a social situation. This one is common, and I see it a lot. I see it a lot in athletics because of the fear of being judged, as well as the evaluation part. So athletes do suffer from this type of anxiety disorder quite a bit, as well as competition anxiety disorder. We have social physique anxiety, which is worrying about how others perceive their physical appearance. So this one is problematic because it could lead to anorexia. So we want to make sure that people have a good relationship with their body and they don't suffer from social physique anxiety, because that could lead to an eating disorder, which is going to be a mental illness, as well as a mental illness that negatively impacts our physical ability. Now, let's look at each of these a little bit more specifically. The general anxiety disorder, the diagnosis tends to occur when 3 or more of the following are persistent over a 6-month time frame. So if you have come into contact or you're dealing with someone who is feeling on the edge, feeling restless or agitated, easily fatigued, mind going blank or difficulty concentrating, very irritable or tense, and have disruptions in sleep, if that's happening long term, they may have the generalized anxiety disorder and need intervention. When it comes to social anxiety disorder, these tend to be more of social phobias. So what tends to happen is people tend to avoid more social or performance situations. So they have a phobia of performing or competing or being around others. The physical symptoms include rapid heart rate, nausea, sweating, panic attacks in some instances. So the rapid heart rate, sweating, that's just because if you've ever been anxious before, most people get anxious when they're about to write an exam, and your heart rate goes up and you sweat. I remember when I wrote the Certified Strength and Conditioning Specialist exam. It was a 4-hour exam, and you needed to get 85% at that time. You needed to get 85%. I think they cut it down to 80 now, but it was 85% you needed in order to pass. It was a 4-hour exam. I probably spent 24 hours being anxious about that exam. My heart rate was high, sweating, I felt sick to my stomach, and it was definitely anxiety, but it was short term. As soon as I wrote the exam, I was fine after. I didn't avoid anything, or it wasn't a social anxiety disorder. It was just anxiety, which every single one of us suffers at some time. But if that's happening chronically, then you know it's something more. Then the social physique anxiety, as I said, it's people that have they're self-conscious about their body, they're self-conscious about what they look like. They tend to be negative about their body, they tend to be negative about their diet, they tend to be negative about their training. Oh, this training I'm doing, I'm working so hard, it's not working, nothing's helping, I'm gaining weight on this, even though they're not. It's a problem, and it can lead to eating disorders. You see this in a kinesiology or sports setting. You see this a lot in female athletes that have to have relatively controlled weight, and it's an unfortunate part of some sports, but it definitely can lead to some big time psychological problems. And it's a concern, especially in a sport like gymnastics, where we seem to want to make young girls stay small for as long as possible so they can make the Olympics. But it's abusive, and it could lead to eating disorders, and it shouldn't happen. It's unfortunate, and we need to be better at helping people understand that their physique is something that is individual and is something that could be worked on healthily. And that's the most important thing. Let's talk a little bit about suicide, because a lot of times these mental illnesses lead to suicide or suicide attempts. It's one of the hardest things to understand and as well deal with. So it's important to know about what suicide is, what leads to it, and how we can help. So suicide obviously refers to an individual who deliberately ends their life. A lot of suicides happen impulsively. there's a time of crisis or stress or something's happening in their life or you know, in their home life or their school life, and they don't believe they can manage it, and they just impulsively end their life. And it's why I always stress to people to make sure that when you say something to someone, you really think about it, because you don't know how they're going to react to it. And that's the one thing that I do not like about social media, is people tend to think that they can just say things negatively and there's no repercussion. And that's why social media with young kids is so dangerous, because you know, a kid might post a picture of something that they're super proud of and they're so happy with, and it brings them so much joy, and they just, you know, it just means everything to them. And someone goes and posts a negative comment about it and it crushes them. And if that's something that's constantly happening, it could lead to an impulsive decision that will impact not just one life, but the lives of everyone around them. And so we have to understand that everyone's mental health is fragile, regardless of how strong they might seem. Everyone's mental health is a fragile component of life. And we shouldn't be breaking it down. We should be building up people's mental health. And we want to be positive with people. We want to make sure that we help people, because we don't want to break them down. We don't want to decrease their mental health. Because what happens is, if someone experiences too much conflict, too much disaster, too much violence or abuse, or they just feel like they've lost so much, or they're isolated, or they're discriminated against, it just increases their risk of suicide. So I always tell people, everyone's mental health is fragile. So take care of it. Help them with it. You don't have to be a psychologist to help someone feel better about themselves. You know, telling someone that they look nice is a simple thing that helps build people up. And it's just little things like that we can do to help people avoid wanting to do something to harm themselves. 3.3% of Canadians over the age of 15 self-reported serious suicidal thoughts in the past 12 months. At 3.3% might not seem a lot, but we are a country of over 30 million people. So you do the math right there. Suicide, higher rates are reported in males versus females, and the highest rates of suicide are found in males between the ages of 45 and 54. So just think about others' mental health when you are helping them or dealing with them or talking with them or just, you know, working with someone. Think about their mental health. Think that it's fragile and help build them up. Some other mental illnesses to be aware of. Bipolar disorder is one to be aware of. It involves alternating periods of depression and mania. So bipolars are people who, they basically go in and out of these states. Some days they have really good days, other days they just have really bad days. And it's one that it could lead to failing mental health. But it's one that can be managed as well if done through the proper channels. Eating disorders are one that all kinesiologists need to be aware of. Every type of eating disorder, whether it's anorexia nervosa, bulimia nervosa, or binge eating. We need to be aware of them as kinesiologists because athletes are constantly dealing with how their body needs to be or is told to be. So it could lead to potential eating disorders. So understanding them is important, and understanding where athletes need to go if they are suffering from an eating disorder to help them is important too. Obsessive compulsive disorder, which involves obsessions and compulsive actions, or both, is one, again, that has varying degrees of severity. And it could be a simple nervous tic someone has to a debilitating habit that affects their daily life. Phobias are a mental illness, and there's lots of different types of phobias. But really, it's this intense, irrational fear of objects, situations, or animals. Yeah, I've seen people who have debilitating phobias against animals to the point where they won't go into a trail for a hike because they're afraid they'll encounter one. Right? So phobias are another one that could really detrimentally hurt someone. Panic disorders. Panic disorders are where we have repeated and unexpected panic attacks for no apparent reason. These can be just absolutely debilitating to people. Post-traumatic stress disorder. This is one when we see someone goes through a great threat of death or serious injury, that they get to the point where it becomes a reoccurring problem. A lot of people have this reoccurring problem in their sleep. They have dreams that they just can't stop having, and it's about the event that took place, or they have thoughts during the day of it, and they just can't get it out of their head. And it's a chronic stress that compiles and can result to serious mental health and mental illness. Then schizophrenia. Schizophrenia is a biochemical brain disorder, and it impacts an individual's ability to negotiate the world around them. Schizophrenia is, again, there's different severities of it, but it can lead to some very harmful actions. So understanding that is an important one. But as I mentioned at the beginning, and I'm going to reiterate this at the end, scope of practice is the most important thing. If you are not in the psychological health profession, then you should not be diagnosing people's mental health or mental illness. You can, as a health professional, help people with prevention, but when it comes to the point where they're suffering, they need to seek help. Health professionals that are trained professionally in mental health and mental illness. Okay, thanks so much for listening, everyone. Don't forget the discussion board question. Right, I'm going to put on the discussion board the mental health in the lectures, mental health, and I'm going to start the thread, and it's, what do you use as a treatment or a way to cope with stress? Okay? All right. Have a great day.